Turning to medical coverage now, in the U.S., the third week of September is known as Asthma Peak Week. Experts say it typically has the highest concentration of asthma flare-up due to ragweed.
A newly released report shares the rankings of 100 U.S. cities from most to least challenging to live with asthma. 12 News reporter Alexandra Leslie joins us now to break down the details of that report, which puts Providence slightly in the middle, while Boston is in a more favorable position. Alex?
Mike, the Asthma and Allergy Foundation of America ranked Providence 58th worst, or in other words, 42nd best, for most challenging places to live with asthma. But researchers also told me the capital city made significant improvements since last year's report. Asthma prevalence and related death rates and emergency department visits are all how the Asthma and Allergy Foundation of America ranked 100 cities the best and worst places to live with asthma. Dr. Robert Sedapane, an allergist in East Providence, says there are many risk factors that can lead to poorer metrics.
Poverty is a big issue, and if you have more challenging neighborhoods, you're going to have worse outcomes.
AAFA's vice president of research tells me Providence, ranked 58th worst, has poorer air quality than Boston, which is ranked 91st worst or 9th best, and also has fewer asthma specialists available per 10,000 patient population. Sedapane believes there are a few reasons to support that.
We're having a retirement and attrition of a lot of pulmonologists as well as the allergists.
Despite that, Providence had the lowest number of emergency department visits, jumping from 47th in 2021 to 100th this year.
Ideally, the asthmatics are getting treated in the community by the primary cares, by their specialists, and you're preventing ER visits. So if we have a low number of ER visits, we're ahead of the class.
Now, Dr. S says while we're in peak ragweed season, allergy sufferers should really be thinking about using controller medicine prescribed by a doctor on a regular basis in order to prevent these severe asthma attacks that could lead to those ER visits. Live in studio, Alexandra Leslie, 12 News.